Have you ever considered the link between heavy metal exposure and cardiovascular disease? Recent findings published in the Journal of the American College of Cardiology have sparked an intriguing conversation. The study suggests a correlation between exposure to heavy metals and an increased risk of cardiovascular disease. This revelation underscores the importance of understanding the potential hazards lurking in our everyday environment. Stick around to learn more about this critical health issue. This groundbreaking study, conducted on over 6,000 adults, spanned a decade. The researchers meticulously tracked and analyzed the participants' exposure to heavy metals such as cadmium, uranium, and copper. They discovered a startling association. Higher levels of these metals in urine were linked to increased calcification in the coronary arteries. This is a key marker of atherosclerosis, a condition where the arteries harden due to plaque buildup, often leading to heart disease. However, it's important to note that this study doesn't prove these metals cause heart disease. Rather, it highlights a significant association between the two. These findings underscore the need for public health measures to reduce metal pollution and exposure. So, what does this all mean for you and your heart health? Well, the recent study strongly suggests that exposure to heavy metals such as cadmium, uranium, and copper might increase the risk of cardiovascular disease. The research points towards a correlation between high levels of these metals in our bodies and increased coronary artery calcification. However, it's crucial to note that while these findings are significant, they don't conclusively establish causation. More research is needed, particularly on the effects of long-term exposure to these metals. Remember, your environment plays a significant role in your overall health. Stay informed and take preventative measures. In conclusion, this study has shed new light on a potential risk factor for cardiovascular disease. It has emphasized the correlation between exposure to heavy metals such as cadmium, uranium, and copper, and an increased risk of heart-related ailments. Findings from the study, conducted on over 6,000 adults over a 10-year period, have shown that higher levels of these metals in urine were associated with increased coronary artery calcification, a marker of atherosclerosis. The importance of public health measures to reduce metal pollution and exposure has been underscored. It's vital to remember that while this study does not establish causation, it certainly highlights a significant area of concern. Stay aware, stay healthy, and remember, your heart matters. Stay ahead of the curve with your daily dose of news. Subscribe now and never miss a beat.